Supervised injection sites. Are they beneficial or harmful to society? Let's start off with some background information. So, what even is a supervised injection site? Well, a supervised injection site is a facility where individuals who are fighting drug addiction can come and use pre obtained drugs as well as obtain clean needles and be supervised by medical personnel in the case of an emergency. So, supervised injection sites are a form of harm reduction. Obviously, the use of illegal drugs can be harmful to anyone, but the major priority of a supervised injection site is to decrease the number of overdose as well as decrease the spread of infectious diseases such as HIV and HCV, which can be transmitted through the use of dirty and shared needles. Those affected by this controversy include the people who are fighting drug addiction, as well as those individuals who are against the use of legal drugs and would be opposed to the implementation of supervised injection sites, as well as everyone within the community where these facilities will be placed. So, why is this topic even significant enough to discuss? Well, for starters, in 2019 alone, the United States suffered from over 70,000 deaths occurring due to overdose, 70% of those deaths being due to opioids such as heroin. Additionally, individuals who experienced an opioid overdose in the United States accounted for $1.94 billion in annual hospital costs. The implementation of supervised injection sites can help to decrease the amount of overdose experienced by people who are struggling with drug addiction, as well as help to relieve the burden on the healthcare system that opioid overdose treatment causes. There are several benefits associated with the implementation of supervised injection sites, and many of these benefits have been statistically proven in Canada, where these facilities are utilized the most. For starters, in Montreal, each supervised injection site prevents 11 cases of HIV and 65 cases of HCV each year. This is beneficial because the decrease of the spread of infectious diseases benefits not only individuals who are fighting drug addiction, but the community as a whole, since these infectious diseases are able to spread not only by the use of dirty needles, but also through sexual intercourse. Additionally, in Vancouver, overdose deaths decreased from 253 to 165 per 100,000 person years within a 500-meter vicinity of the supervised injection site. This is beneficial because one of the main priorities of a supervised injection site is to decrease the number of overdose seen within the community. Lastly, the average monthly ambulance calls regarding opioid overdose decreased from 27 to 9 in Vancouver. This is beneficial because it proves that the amount of overdose is decreasing, and it also allows emergency resources to be provided back to the general public rather than for treatment of overdose. The thesis statement for my research paper is as follows. Although recovery from drug addiction would be the best outcome for all individuals fighting substance abuse, the priority of a supervised injection site is to practice the ethical principles of beneficence and utility by minimizing the risks associated with illegal drug use, as well as benefiting the community as a whole. The ethical principles in support of the implementation of supervised injection sites are autonomy, beneficence, and utility. Beneficence and utility being the most important ethical principles in regard to my topic. So, in regard to autonomy, it is each individual's choice whether or not they want to keep using drugs or to go into recovery. So, as I said in the previous slide, it would be the best outcome for all individuals to go into recovery and to stop using illegal drugs. However, we have to respect the autonomy of each individual and let them decide when they are ready to recover. For beneficence, it is the healthcare professional's duty to minimize the risks associated with substance abuse and maximize the most positive health outcomes. So the implementation of a supervised injection site will allow the risks of overdose to be reduced, and it will also maximize the most positive health outcomes because individuals are able to use pre-obtained drugs as well as clean needles. Now on to utilities. So supervised injection sites will benefit the community as a whole because valuable hospital and emergency resources are able to be given back to the general public, and the spread of infectious diseases such as HIV and HCV will decrease, which benefits all individuals within the community. Now on to the ethical principles that oppose the implementation of supervised injection sites, which are justice and non-maleficence. So in regard to justice, under federal law, it is illegal to possess, use, and distribute illicit drugs. Therefore, if we are looking at this ethical controversy through the eyes of the law, it would be unethical for supervised injection sites to allow individuals to use illegal drugs. For non-maleficence, allowing patients to do drugs under the supervision of the healthcare team is allowing them to harm themselves. So doing drugs in general is harmful to the body. So if a healthcare professional is allowing their patient to do drugs, they are allowing them to harm themselves. Now let's talk about laws, codes, and duties. So for starters, possession, use, or distribution of illicit drugs is prohibited by federal law. So this is why the ethical principle of justice would be opposed to the implementation of supervised injection sites because it is illegal under federal law to possess, use, and distribute illicit drugs. Next, the AMA Code of Ethics states that a physician shall recognize a responsibility to participate in activities contributing to the improvement of the community and the betterment of public health. The reason that this section of the AMA Code of Ethics applies to my topic is because the implementation of a supervised injection site will contribute to the improvement of the community and the betterment of public health by decreasing the spread of infectious disease, as well as allowing valuable hospital and emergency resources to be given back to the general public. Lastly, the ACHE Code of Ethics states a healthcare professional must work to provide a process that ensures the autonomy and self-determination of patients or others served. Many people opposed to the implementation of supervised injection sites believe that the best outcome for all individuals fighting drug addiction is to go into recovery. However, it is the healthcare professional's duty to respect the autonomy of each individual. And if we respect the autonomy of each individual, it is important for us to recognize that not all individuals fighting drug addiction are ready to go into recovery. Therefore, we need to provide them with services in regard to their individual circumstances. My stance on the resolution of the controversy is that supervised injection sites should be utilized, especially in communities that are struggling with drug addiction the most. And although illicit drug use is illegal and poses harm to the body, the ethical principles of autonomy, beneficence, and utility outweigh the principles of justice and non-maleficence. The solution that I propose for the future is to conduct a trial of supervised injection sites. So my idea is that we place a small number of supervised injection sites in areas that are struggling with addiction the most, such as New York, Chicago, Los Angeles, Atlanta. And we would allow these facilities to run for a year. And after that year is up, researchers can gather data and do a statistical analysis and see if there is a decrease in overdose and infectious disease within that community. This will allow people to visualize the benefits that supervised injection sites are able to bring to the community. In conclusion, I wanted to reiterate that most people would prefer that individuals fighting substance abuse would go into recovery. However, it is important to recognize that this is not always possible. For those people who are not ready to recover, it is the healthcare system's ethical obligation to minimize the risks associated with illegal drug use. On top of that, the implementation of these supervised injection sites will not only help individuals fighting drug addiction, but they will also benefit the community as a whole by decreasing the spread of infectious diseases such as HIV and HCV, and they will also allow valuable hospital resources to be given back to the general public.